The menstrual cycle. The menstrual cycle is a complex series of physiological changes that occur in women of reproductive age on a monthly basis. The end result of menstrual cycle is the production of an ovum and thickening of the endometrium to allow for implantation. Menarche is the first menstrual cycle, which normally occurs between the ages of 11 and 15 years. And the menopause is when a woman stops having periods and is no longer able to get pregnant naturally. It occurs between the ages of 45 and 55. The normal duration of a single menstrual cycle is 21 to 35 days. The uterus is composed of 3 tissue layers. They are perimetrium, myometrium and the endometrium. The endometrium is the layer of tissue lining the uterus. This endometrial lining consists of a functional layer and a thin basal layer. The functional layer of endometrium depends on hormonal changes and is shed during menstruation. The basal layer feeds the overlying functional layer. The menstrual cycle is actually made up of 2 cycles that interact and overlap. 1. The ovarian cycle. It refers to the series of changes in the ovary during which the ovarian follicle matures, the ovum is shed and the corpus luteum develops. 2. The uterine or endometrial cycle. It refers to the series of changes in the uterus where the functional endometrium thickens and sheds in response to ovarian activity. The ovarian cycle is divided into 3 phases. 1. Follicular phase. 2. Ovulation. 3. Luteal phase. Follicular phase. A follicle is a small, fluid-filled sac in the ovary that contains one immature egg. There are thousands of follicles in the ovaries. In this follicular phase, the follicles begin to mature and prepare to release an ovum. At the beginning of the cycle, the pituitary gland produces 2 hormones, follicle-stimulating hormone and luteinizing hormone. Follicle-stimulating hormone stimulates the growth of eggs in the follicles. These follicles then begin to produce estrogen. As estrogen levels rise, like a switch, it turns off the production of follicle-stimulating hormone from the pituitary gland. Only one follicle in one ovary continues to mature. This dominant follicle suppresses all of the other follicles. Prior to ovulation, estrogen levels continue to rise as the dominant follicle matures. But then, on the day prior to ovulation, a switch occurs in which estrogen now causes a surge in luteinizing hormone. The luteinizing hormone surge causes release of the ovum from the follicle approximately 36 hours later. As the ovum is released, it is captured by the fallopian tubes. The luteal phase occurs during the second half of the menstrual cycle, after ovulation has occurred. It starts after ovulation, on day 15 of your cycle. The luteal phase is consistently about 14 days long. During the luteal phase, the empty follicle develops into a small yellow structure, or cyst, called the corpus luteum. The corpus luteum secretes progesterone and estrogen that cause the endometrium to thicken and be able to nourish a fertilized egg. When sperm fertilizes an egg, the resulting embryo travels down the fallopian tube and implants in the uterus several days after ovulation. The early embryo begins to make human chorionic gonadotropin, HCG, which maintains the corpus luteum and progesterone production. The corpus luteum will sustain the uterine lining and pregnancy until the placenta develops. If the egg is not fertilized and an embryo does not implant, the corpus luteum deteriorates, and progesterone levels will fall. Without progesterone, the endometrium isn't maintained and the uterus will start to shed its lining, resulting in menstruation. The uterine or endometrial cycle. The uterine or endometrial cycle is divided into two phases. They are the proliferative phase and the secretory phase. During the proliferative phase in the uterus, the hormone estrogen is released from the maturing follicles in the ovaries. Estrogen stimulates the proliferation of cells in the endometrium of the uterus. Estrogen also initiates the increased growth and motility of the myometrium and production of a thin alkaline cervical mucus, to facilitate sperm transport. The secretory phase runs alongside the luteal phase. During the secretory phase of the uterus, the hormone progesterone is produced by the corpus luteum. Progesterone secreted by the corpus luteum stimulates the further build-up of the cells in the endometrium of the uterus. Progesterone also stimulates the glands in the uterus to secrete substances that will either help an early pregnancy, or help the lining break down and shed if no egg was fertilized. Menses marks the beginning of a new menstrual cycle. It occurs in the absence of fertilization once the corpus luteum has broken down and the internal lining of the uterus is shed. Menstrual bleeding usually lasts between 2 to 7 days with 10 to 80 ml blood loss. Dysmenorrhea is the painful periods and is the most common gynecological symptom. It is generally described as a crampy lower abdominal pain which starts with menstruation. The pain can be associated with other symptoms, such as malaise, nausea, and vomiting and dizziness. Thank you. The menstrual cycle. The menstrual cycle is a complex